Let's talk about something that's been quietly gaining momentum, something that might not be on your radar just yet. It's about slow pandemics. I know, after the chaos of COVID, the lockdowns, and the constant barrage of information, hearing pandemic again feels like déjà vu, a trigger for anxieties we'd rather leave behind. But what I'm talking about isn't a blockbuster outbreak, a sudden global crisis that dominates the news cycle. It's the return of diseases we thought we had under control, diseases that were once on the brink of eradication. I'm talking about diseases like measles. Here's the wild part, the part that should make you sit up and pay attention. Measles cases worldwide shot up by 18% last year. That's a significant jump, a worrying trend that demands our attention. 18%. That's not a blip, not a minor fluctuation in the data. It's a warning sign, a red flag indicating a potential public health crisis in the making. Countries that hadn't seen measles in decades, countries where the disease was virtually non-existent, are suddenly facing outbreaks. They're scrambling to contain the spread and protect their populations. And it's not just measles, it's not an isolated incident. We're seeing upticks in mumps, whooping cough, diseases that were also largely under control thanks to widespread vaccination efforts, and even polio in some corners of the world. A disease we were so close to eradicating completely is now making a comeback. Why is this happening? What's causing this resurgence of diseases we thought we'd conquered? A big reason is that routine vaccinations dropped during lockdowns. The COVID-19 pandemic had a ripple effect on other areas of healthcare. Schools closed, clinics got overwhelmed, resources were stretched thin, and parents hesitated to visit doctors, fearing exposure to the virus. Now, millions of kids have missed their shots, creating a significant immunity gap, leaving cracks in our collective immunity. This weakened herd immunity makes us all more vulnerable. Here's the thing about measles, and why this resurgence is so concerning. It's insanely contagious, one of the most contagious diseases known to humankind. If 10 unvaccinated people are exposed, if they come into contact with the measles virus, 9 will get sick. That's a 90% infection rate, an incredibly high number. And measles isn't just a bad rash. It's not a mild childhood illness to be taken lightly. It can cause pneumonia, brain swelling, serious and potentially life-threatening complications, and even death, especially in vulnerable populations, especially in young kids. Infants and young children are particularly susceptible to severe complications from measles. But measles is just the tip of the iceberg, a visible symptom of a larger underlying problem. These slow pandemics creep up quietly, spreading gradually and often unnoticed. They don't make headlines like COVID, they don't generate the same level of public alarm. But they can still do serious damage, eroding public health and straining healthcare systems, especially to the most vulnerable among us. Children, the elderly, and individuals with compromised immune systems are at the greatest risk. Now I get it. I understand the hesitation and the confusion surrounding vaccines. There's a lot of vaccine misinformation out there, circulating online and fueling skepticism. It's easy to feel overwhelmed or skeptical, bombarded with conflicting information and unsure of what to believe. But the data is clear. The scientific evidence is overwhelming. Vaccines work. They are incredibly effective at preventing serious diseases. They're one of the safest and most effective tools we have in our arsenal. We have to keep these diseases at bay. We must protect ourselves and our communities from these preventable illnesses. So what can you actually do? What steps can you take to address this issue? Start by checking your vaccination status, making sure you're up to date on all recommended vaccines, and your families. Ensure that your children and other family members are also fully vaccinated. If you're not sure, ask your doctor. Your healthcare provider can review your records and provide personalized recommendations. And if you have questions, if you're feeling uncertain or confused, dig into reputable sources. Consult trusted medical websites and research institutions. Don't let fear or rumors make decisions for you. Base your choices on facts and evidence, not on misinformation and unfounded claims. The bottom line, the key takeaway from all of this? Slow pandemics are silent. They don't announce themselves with grom-key headlines and dramatic pronouncements. But we don't have to be. We can raise awareness and take action to protect ourselves and others. By staying informed and making smart choices, by prioritizing vaccination and seeking reliable information, you help protect not just yourself, You contribute to the overall health and well-being, but your whole community. We all have a role to play in preventing the spread of these diseases. Thanks for watching. Thank you for taking the time to learn about this important issue. Stay curious, stay safe, and continue to prioritize your health and the health of those around you. And don't sleep on the slow pandemics. They may be quiet, but their impact can be significant.